Hello, this is Roberto Olivo. I'm a licensed mental health provider, and I would like to talk to you briefly about why a person, a family, a group of individuals will come to my office and request my services, or in general, the services of a mental health provider. We continue to believe in society, in our community, that only crazy people goes to see a mental health provider. And when we're talking about a crazy people, I believe the majority are referring to people who might be seeing things that are not there, hearing things that are not there, feeling things that are not happening. And in reality, that's more in the area of schizophrenia. But people in general come to my office because they are seeking help with from the most basic to the less basic. The most basic will be depression, anxiety, um, and from there we'll continue to go to other needs than the person has, and they could be mental health needs, it could be emotional needs, and so we treat people who, in addition to depression of anxiety, who might be also experiencing panic attacks, which is an extreme form of anxiety. We treat people who may have some type of addiction, uh, unhealthy way to cope with the stressors in your life. And when I'm talking about addiction, I'm not only talking about the traditional alcohol, people who are addicted to alcohol, who are who cannot stop drinking, and also I'm not only talking about people who are doing cocaine, for instance. Uh, there are addictions related to drugs. There are addictions related to alcohol, which are the traditional and what people usually think about when we say the word addiction. But there is also the addiction to gambling. There is also the addiction to sex. There is also the addiction to food. There is also the addiction to work. There is also the addiction to exercise. So there is a variety of addictions: addiction to coffee, addiction to marijuana, um, and other more prescribed medications to sleep or to for pain medication. So addiction has a huge menu of possibilities, but everything will go under the umbrella of addiction. So we treat addiction. We treat when you're having problems in your interpersonal relationships with your spouse, when you have problems with your children, when you have problems with your parents, when you have problems with your siblings, when you have problems with your friends, when you have problems with your coworkers, in when you have problems in relationships, we'll be able to help you out to figure out what it is. When you have problems with yourself, meaning, do you know who you are? Do you know what you want? Do you know what you want to be when you grow up? Do you want to do you know where you want to be in 5 years from now? So when you have some problems about yourself, when you have problems about setting healthy boundaries with others, when you have problems saying no, when you have problems saying yes, where you have problems communicating, where you become very reactive to statements about you, when you become very reactive when people judge you or when people define you, um, when you believe that what they say is true and what you said or what you believe is not, those are some of the issues that we help you to figure out. When we are able to figure out why you are not happy, when we are able to figure out what you need to do to help you to be happy. So, being able to provide mental health services, I believe it should be mental and emotional health because it's not just about psychology, it's not only about the psychic, it's also about the mental health. When your heart has been broken for whatever reason, and the problem here is not try to find out who did it, who is guilty. but it's about how we mend that broken heart, how we help you to achieve satisfaction, how we help you to find happiness, how you help you to improve your relationships, your romantic relationships, your professional relationships, your family relationships, your friendly relationships, how you move forward, how we help you to move forward when you are stuck in your life, when you are not able to move forward, where you're not able to have a relationship with fear paralyze you, when you're not able to take chances in life, where you're not able to go for what you want and what you deserve. That's what a mental health provider should be able to help you to figure out. Now, selecting the correct mental health provider is extremely important. The way I tell my patients or my prospective patients is shop around. Go and ask for a 10, 5, 15 minutes free consultation with a mental health provider to figure out what issues you have, to figure out how they respond to your questions, to figure out if there is an emotional communication link, click, when you feel that that person is someone that you feel at ease to be able to talk to. It's like similar when you go and buy a new pair of shoes. You need to try a few pairs before you find the right size and the shoe that is to your likings and it feels comfy. Comfy enough to purchase it and to use it daily. Mental health obviously is not daily, although it could be in psychoanalysis, but it could be weekly or every 2 weeks, depending what your finances are, depending what your insurance is allowing you to, depending what the problem is. But it's something that you're going to be using regularly, and then you need to be able to trust 100% to be able to have an effective treatment. Okay, so mental health services are not only for people who are crazy. Mental health services are for people who need some type of professional counseling service to help them figure out what is not working, why is not working, how my past continues to haunt my present and prevents me from moving forward, what kind of changes I need to implement in my life to be satisfied and happy with who I am, what I'm doing, who I'm with, and what I want to accomplish in my life. Mental health services shouldn't be a forever treatment. Mental health services should be a timed treatment that will start and have an end, and then you could be able to see the progress. You'll be able to see how you have accomplished the goals that you set at the beginning of the treatment, and and that if in the future you need to enter or re-enter mental health services, you could do that. But mental health services shouldn't be a life-lasting process. That is my opinion. Okay. If you have any questions about mental health services in you, or if you have any problems about mental health services in a taboo, contact me. I'd be more than happy to share with you what I believe works, what I believe might be some of the issues that you may have, and to refer you out or to be able to help you myself. So have a great rest of the day, and I will see you next clip. Um, Nice seeing you.